Welcome to the Movement Upgraded podcast. I'm your host, Dr. Jen Hostler, licensed physical therapist and certified strength and mobility coach. Here you can expect to hear about all things movement. The Movement Upgraded podcast is a blend of the science of strength training, rehab, and mobility, mixed with the personal and professional experience to provide you with the steps you need to keep your body pain-free and moving well, so you can do what you love forever. Welcome. We are back at the podcast today going to talk about cramps, specifically like cramps when doing mobility work or an exercise. Like there is a difference between getting like general body cramps, like calf cramps from being dehydrated and flexing your calf muscle and the whole thing seizing on you, or like running a marathon and you start to have cramps in your legs, like all throughout, right? What I'm referring to today and what this episode is going to be about is when you go to maybe do a new exercise, maybe you're getting into some PALS rails, and as you start the rails contraction, it's very common to experience some cramping, like very directly related to as you are ramping up the intensity in the contraction to have a cramp sensation. And very often that cramp actually becomes like a full-blown like muscle spasm and you fall out of the position. That is like very, very common for anybody who is newer to mobility work and or new to that movement or that position. You may we'll talk about like when this typically happens, but that's very common. So this episode is going to be about that. So in that realm, you could basically eat or drink all of the electrolytes, eat all the bananas, drink all the water you want, and you're still going to cramp. So this is not an electrolyte problem. This is something different. And that's what I wanted to highlight today. One of the things that we typically will say is like, oh, you just need to eat a banana, right? But if it's very specific to a movement or a position, it's not just an electrolyte imbalance. It is something that we're going to talk about today. So this episode is going to be relatively short. I'm just going to cover what cramping is, why it happens, and whether or not it's something you want to push into and kind of like what it means, because it's information. And a lot of the time when I talk to people, a lot of mobility work in general is exploration and experimentation. And as much as there is a science to training and fitness and mobility work and everything, it is also highly individual. And as long as you can understand and explain what adaptation you're trying to achieve, like a lot of it's exploratory. And as you start to explore new uncharted territory in your body, very often things that you have never contracted or had to work or worked in that position are going to wake up and be like, what the heck? Or you're going to not have access to those tissues, or you're basically going to achieve or experience, there's the word I'm looking for, different types of things that otherwise you wouldn't have. And so when we are in uncharted territory doing something new, it's very common to experience something like cramping. Cramping for a lot of people, because they're not used to it, they are afraid of it. And so when I work with a lot of people, they'll experience a cramp and they'll panic, or sometimes they'll tell me that they're feeling pain. And this is why if you're a coach or clinician, I always clarify information. When I first started out, if a client or a patient told me they had pain, I was very much in the realm of pain means we don't push into it, right? Like no pain, we cannot have pain. Now that I am more experienced, I realize that people struggle to understand what they're experiencing in their bodies. And then they struggle to communicate that on top of it, right? There's two barriers there, understanding and feeling what they actually are feeling. And then being able to communicate that to somebody else is very difficult. And so a lot of people will experience a cramp, but sometimes they'll think it's pain first. And one of the first things that I teach is when we are doing a movement or something that's new, I talk about where I want them to feel things and where I don't. And we always talk about closing and opening angles of the joint when it's moving. And if you feel something on a closing angle, I generally tell them avoid that at all costs, right? That is a very beginning, when we learn something new, it's easier to have bigger rules to just follow the rules because it's already hard to learn a new skill. The key is understanding that those rules aren't hard and fast. They're just to start. And as we get deeper into our practices, then we're going to get a little bit more specific. So usually I'll work with people and tell them, avoid any closing angle sensations. Then as we work together later, I will start to clarify. Usually it's like the second visit or the second time I see them. I'll clarify, okay, so if I didn't have time in the first session to go through everything and understand what their experience, then we clarify, what are you actually feeling? And a lot of times it's actually more of a cramp sensation in the closing angle, part of the joint. And so if it's cramping, that is the only thing I allow them to push through because of what it means. So let's start with talking about when cramping or why cramping typically happens. Then we'll talk about when it happens. So if we think about our muscles, they have the ability to contract or shorten and produce force. We have the ability to contract a muscle and one muscle doesn't contract. It's multiple muscle fibers together, but when it contracts, we can contract on a very low level, or we can produce a high amount of force contracting really hard. And so I'm not going to get super in depth and sciencey in this. We're just going to stay at this top level of understanding. So there is a difference in how much my bicep, for example, would need to contract if I am just bringing a glass of water to my mouth. So I'm kind of bicep curling that water. It's not very heavy, right? Then if I were to have a 50-pound dumbbell, I'm going to be giving all of my strength. I'm going to be really contracting my biceps, and honestly, the dumbbell is probably not going to move very far because I don't think I can curl a 50-pound dumbbell. But that is a different amount of force. So my muscle is going to contract harder, right? A cramp is essentially your muscle just contracting as hard as it can. It's just like a spasm, a 100% muscle contraction. It's just squeezing, but it's not necessarily producing force. So you're not having movement. You're just literally it's squeezing as hard as it can. This is something that happens when our nervous system, so the reason a muscle contracts is because the nerve sends the impulse, which tells it to contract, in a very, very simple, oversimplified explanation. And so when that connection is not super strong, and there's a connection from obviously our brain to the nerve, there's multiple stopping points there before we actually get to the muscle, but any of those cannot have a great connection. And so instead of having the ability to only contract that muscle a little bit, or the amount that we are asking it to. So when I do a lot of mobility work with people, I will start with just asking them to connect at a 10% contraction. And then we slowly ramp up from there, we're turning the volume dial up on a radio station. And so as we're doing that, they're trying to find what those different percentage of contractions are, to get maximal optimal control, because we don't always want to only have control of a muscle at 100% and 0. We want all the in between for all of the in between things that we're going to do with that muscle, or that set of muscle fibers. So what typically happens when we don't have good control or the ability to fine tune how much contraction we need, that muscle's okay, you want me to contract, I'm contracting, right? And it's boom all the way up to 100%. We don't have that in between. So it doesn't mean anything bad. It just actually means we don't have control, or in a very easy way to understand, and the way I explain it to my clients and my patients, is you just don't have strength in that position. So this is position specific. Strength is position specific, meaning the position of our joint, if we're talking about the elbow again, how far it is bent versus how straight it is my range of motion. And the position of my forearm is at varying levels of elbow flexion and extension. So flexion is bending it, extension is straightening it. As I move into different positions, I can be really strong in some of them and have no strength in the other. And that can be the same muscle group. My biceps can be strong in one position and not in another position. And for most muscle groups or most joints, it's plus or minus about 15 degrees of range of motion. On average, right? And so a lot of times we'll be putting people into positions they've never actually gone into or haven't for a very long time. And then we ask those muscles to contract, and one, they either cannot contract anything. They're like, I don't know what you're talking about. And we spend like 20 minutes trying to get them to understand that contraction. I have like so many different ways of getting people to feel things they need to feel. Or two, they try to contract and it just goes right into that muscle spasm or that cramp. And so if it happens where we go into the cramp, then we have to learn to, one, basically be okay with tolerating it. Some of mobility work's not fun. Strength work is not fun. Fitness is not fun. I know I'm really selling this for you, but it's just not like a fun thing to do. But most things that are worth working on are not necessarily fun or easy, and you just find some way of, like, for lack of better words, falling in love with the process. But most people, once they start to do these things, they're like, yes, I know this is what I need. And they start to feel really good afterwards, or after like a while of being really consistent with this work, and they start to see the carryover, and then you want more. That's a lot of like fitness in general. So a lot of experiencing the cramping is, one, being okay with understanding that you're going to experience cramping. And it's actually something that I tell my clients that they're going to want to work through. So this is hard because usually we're like, no pain. I don't necessarily want it to be awful. And then there's the other side of fitness that's like, no pain, no gain, like balls to the walls. It's gotta hurt, you know? And I'm just like, I'm not really for either of those. I really am in the middle where it's like, no, I mean, when we're lifting, like there's a burn, like it's hard. You're pushing yourself, you're pushing your limits, like you're getting into those areas of like, am I safe? Kind of. And that pushes your boundaries, but that's what fitness does. And so mobility works the same, right? You're going to be going into cramping and you're going to push into it. Now, I'm going to give you a few tips on that. So don't just like go into the full blown cramping without any intention behind it, because it's not just push through it. I usually tell people I want you to flirt along the edges of cramping. And I tell them this because, one, cramping is something, it is one of my favorite ways to measure progress, because I'll be honest with you, watching mobility progress is like watching paint dry. It is like millimeters of progress over time. It's so insubstantial, but also those millimeters actually result in like huge gains in the real world. So like, a lot of people are so used to, in fitness, getting these huge results. And so they're like, yeah, I'm jumping in like my PRs by like 10 pounds, or like I have these huge gains. And so when we do mobility work, it's like we bring that understanding from general fitness into mobility work, when in reality, mobility work is like millimeters. It's like baby little steps. And so one of those little steps is going to be less cramping, or you're able to contract harder before you feel the cramping. And so this is where we get really specific with, okay, how intense am I contracting that muscle? And can I find an intensity that's a little bit lower than where I would get a cramp? So this is where that whole concept of ramping, we call it iso ramping, where you are contracting and you're slowly turning that volume dial up in intensity. So you're starting just like a little bit, you're just connecting, you're feeling a little contraction, and then you're going to contract a little harder, a little harder, a little harder. And I usually have people go from like 10 to 20 to 40 to 60 to 80, and then we go, or we stop there, right? Like sometimes I have people at those middle or lower intensity contractions. It just depends, but I will ramp them slowly up. So we're ramping up over 10, 15, sometimes even 20 seconds before we actually start the iso hold. And that is important because that's where we learn how to contract in all of those ranges. Now, sometimes, again, we bypass that and we go really fast, but when they're new, and especially if you're cramping, then we really want to ramp very slowly up and try to avoid that full-blown muscle like spasm, right? So I do want you to flirt with the edges of cramping, maybe push into it a little bit, but that's it. Like, don't push into the full cramp, because a full cramp means you're going to be thrown out of the position, right? And if you've ever done, I'll give you like the most common position for cramping. There's going to be two, but I think the biggest one is going to be when people are doing, I want to say a couch stretch. Yes, a couch stretch, which is the quad stretch, where your quad is being stretched, your back, shin, and foot are up against a wall or a couch, and you're kind of in a lunge position, or maybe you're not, depending on how tight you are. You might not even be in the full lunge position. And so the back leg is working on getting stretched. And the quad is. And so a lot of people will hold the stretch, and then we do Pales rails. So Pales is going to be pushing that foot into the wall where you're contracting your quad, and that is Pales is always starting with contracting what is stretching first, because we actually get a relaxation effect after the contraction, which allows you to get a little further into the stretch. And the rails is going to be the opposite side stuff. So this would be what would pull you into a deeper stretch. Now, when we do rails in this position specifically, it is hamstrings. And hamstrings with a bent knee, working on those is like so hard and miserable for people, because we don't work on hamstrings in their shortened range of motion. We sometimes do lengthen, but we really don't even hardly work on the hamstrings at the place where they cross the back of the knee. We're really often focused on the middle of the belly of the hamstring, and then the distal, not the distal, but the more proximal attachment, which is up on your pelvis. And so we just don't work on our hamstrings in that shortened range of motion with bending the knee. And so because of that, we don't have strength and control there. It's very like our body adapts to what we do or don't. It's very specific, right? If you don't train it, you're going to lose it. And so a lot of people, when they start to do this, they have to be told, all right, as we move, like I usually preface people this while they're sitting in their stretch, because I'm like, here's what Pales is going to be. And then I brush over that. And I'm very cautious, because usually Pales with the couch stretch, we have to be very careful, because inducing some force in a very lengthened position is a very great way to pop a quad, like tear a quad, right? If they're not used to ever stretching, and they're in an extreme position and they're at a really high stretch, and then they try to do a Pales contraction, which is inducing force in a lengthened position. It's a lot of force from a tensile, like stretching force. So stretching is already forces on your muscles, and then you're adding more force by contracting that muscle. It is a really great way to induce too much force too soon after not doing enough for too long. And that is where we have those injuries. So I usually have to preface people to be very low intensity in their stretch at first, and then low intensity with their contraction for the first round of Pales rails. And then when we go into rails, which would be pulling their heel towards their butt, I usually have to cue people, all right, first we have to make sure you don't move into an anterior pelvic tilt, right? So that would be like thinking about your tailbone, lifting it up to the ceiling, or sticking your butt out. Most people will do that as a compensation to find a more lengthened position of their hamstring, to find the position where they own their hamstrings. And I want them to avoid that, because we're trying to get in the position where they don't own it, and we're trying to own that, right? Which is why mobility work is so hard, because you're fighting every natural urge of your body to do things as efficient as possible. We're trying to make it inefficient, because we want to give it more options, right? So when they go in to do that, the second thing I tell them is, hey, you're probably going to get a hamstring or like calf cramp. Please proceed with caution. I just want you to barely feel like you are making your foot light against the wall. I want you to just think about lifting your foot off the wall, but don't actually do it. Just contract the muscles that would do that at like a very 1-2%. A lot of people will not know what 1 to 2% is, and they'll still contract really hard, and they'll cramp, and they'll fall off and out of the position and roll around for a little bit. We'll have some good laughs, and then we'll get them back up there. And so a lot of times when I'm first introducing people to this, it takes a very, very long time to get them through it. And this is why it takes me several sessions to work on getting people's home programs together, because the nuance and just the details, I go into a lot in how they're feeling. So sometimes I won't even do Pales rails the first session. I'll just get them to stretch and get exposed to that new position. But the gist is we're trying to avoid the cramping into a full spasm at first. And then eventually I'm going to tell them like what the cramping is, like we're talking about today. And I tell them I want them to push into it a little bit. And that progress is going to be being able to push a little harder, and then before you feel the cramping, or less cramping, or maybe you don't have cramping. That's what we look for. The other time people feel a lot of cramping is when I coach them through hip cars, and as they're bringing their knee up, they go out, and as we're going from abduction into that abducted position and then into internal rotation, a lot of people, when they first do this, they won't do them as intensely to feel that. They'll kind of drop out of the movement. But when I coach them how to actually upgrade their hip cars and not compensate with their back, they will feel their outer hip most of the time as they're going into abduction and internal rotation. And so when they do that, I actually tell people, if you feel any cramping in your cars, I want you to push into that a little bit. Now, We always want to be cautious about cars in our morning routines. They should be pretty chill, right? I don't necessarily want you looking for some upregulation, some intensity in finding the cramping. But I do want you to do that a couple times a week, maybe for a strength training session, right? Like this is where cars for your warm up is really helpful, where you're really pushing that intensity. And so if your question is, you hear that like cramping means you have a lack of strength and a lack of control. Pushing through the cramping is obviously going to be the way that we gain strength, and eventually that cramping will stop. And if you're asking if it ever does go away, the answer is yes for most people if they stay consistent. But again, it takes time. But cramping is usually one of the first things that starts to dissipate as you consistently expose your body to that position. It's just very much the very beginning stages where your body's like, what the heck is this, right? And then as you progress mobility work, it's very common for that cramping to come back again. And so it doesn't necessarily mean you've lost progress. It usually just means, all right, we introduce something new. Right? It's kind of like DOMS in that way, where it's like a new stimulus, but it has a meaning. It means you don't have strength in that position, right? So remember that it's a lack of position-specific strength. So if you are hearing this and you're like, okay, I definitely have cramping, but now I know that I can push into it, then I want you to do that. But again, remember, we're not pushing into that full spasm, right? So cramping is okay. It means that we don't have strength and control in that position. We want to push into it without an intense spasm happening. So we want to flirt with the edges of it. And it's also a great way to measure progress. Those are the main points that I wanted you to get out of this. I ended up going longer than I thought I would, but I gave you some examples in there. So if you have further questions about this, I believe I have a post like somewhere on my Instagram profile about it. You can always check that out, like scroll through my feed. And see, I know I have it somewhere. But you can also always email me or send me a message on Instagram. I love hearing from people. If this was like mind blowing to you and you're like, oh my gosh, this makes so much sense, and you want to share a light bulb moment with me, also happy to hear that. If you haven't already, go hit a 5-star review for the podcast. I appreciate it so much. It's the best way to support all of this free content. And with that being said, we are concluding the muscle cramping podcast, and I will see you, or I will chat with you in the next one.